September is known for many things, but it's also Prostate Cancer Awareness Month. It's a very common form of cancer, but a lot of people get put off getting screened for it. We want you to know the risks and what you need to do, and that's why we have Dr. Lester Borden with us. He's the Prostate Cancer Medical Director at Cone Health's Cancer Center. So we're going to be discussing who needs to get screened and when. He's also talking about risk factors that you need to know about. All right, so let's first and foremost, let's start off with something, really easy here. Like, just how common is prostate cancer? It's probably a whole lot more common than most of us at home think it is.
Sure. Well, first of all, thanks for having me on today. So prostate cancer is the most common cancer in men, with over 260,000 men diagnosed per year. It's also the second leading cause of cancer death in men, with about 35,000 men expected to die from prostate cancer this year alone. That being said, as long as it's diagnosed at an early stage, prostate cancer is very treatable and highly curable.
All right, so you just heard him tell you that it is one of the highest rates for cancer deaths, right? But you also heard him say that it is one of the most preventable. So let's talk about that. What risk factors increase a man's risk of prostate cancer?
Sure. Well, like most cancers, prostate cancer is more common as men age. About 1 out of 8 men will be diagnosed in their lifetime, which is very similar to what we see in breast cancer in women. But there are certain men who are at a higher risk, and this would include any man with a first-degree relative, such as a father, brother, or uncle who has had prostate cancer, as well as Black men who may not only have a higher risk of prostate cancer, but also are potentially at a higher risk for more aggressive prostate cancer.
All right, so let's go through the signs and the symptoms of prostate cancer that men and really the women in their lives should be aware of.
Sure. So one of the main problems with prostate cancer is that it doesn't really cause any symptoms until it's already reached a pretty advanced stage and is usually beyond cure at that point. And so because of this, men have been screened with a blood test called PSA, or prostate-specific antigen. This is a protein made by the prostate, and this test can help detect prostate cancer at an earlier stage before symptoms develop and when it is still curable. And while we know this test can lower the risk of dying of prostate cancer for many men, the other problem with prostate cancer is that some of these cancers are pretty slow growing and really may not be life-threatening, especially for men who may be older with shorter life expectancies. So one of the concerns about PSA screening has been that men with these non-aggressive cancers could be potentially overdiagnosed and overtreated if the PSA test is used indiscriminately on everyone. And that's what used to be done in this country. And this has led to some controversy about who really should undergo the PSA test. It's resulted in confusion for both patients and also primary care doctors. And ultimately, it's led to a lot of inconsistency among different primary care providers in how they approach prostate cancer screening. Fortunately, we now have much better information to guide us, and the data is now fairly consistent about who should and who should not undergo routine PSA screening.
Okay, so then let's talk about that. When do men need to get screened, and then when should they start having that conversation with their provider?
Sure. Well, because of what we just discussed, understand that prostate cancer can be slow growing in many men. The men who are going to receive the most benefit are obviously going to be those who have longer life expectancies. So it's now pretty clear that if a man's going to live less than 10 years, they receive pretty minimal to no benefit from routine screening. So this would include most men over age 75, men who might be younger but might have other serious medical conditions that would limit their lifespan. On the other hand, men who are at a high risk for prostate cancer likely should start being screened even in their 40s. And this would include, again, Black men with a family history of prostate cancer, such as a father, brother, or uncle. And then for those men who are at an average risk, who really have no risk factors but are expected to live at least 10 years, there certainly is a potential benefit to undergo PSA screening. And these men just need to become educated about prostate cancer screening, and through a shared decision process with their medical provider, they can decide if it's right for them. And that discussion for these men at average risk would typically begin around age 50 to 55.
Okay. All right, and that's something that, too, I think of as a wife. I think to myself, I'm wanting to make sure that I'm part of the discussion as well, because it's kind of true that, like, the women kind of lead the men to go to the doctor.
We see it all the time.
Yeah.
Absolutely agree.
All right, when we come back, we're going to discuss possible warning signs for prostate cancer. We're going to debunk some misconceptions as well, and that's coming up right after the break.